I've always been interested in the way the body works. I always knew that there was such a thing as orthopedics because my dad was an orthopedic surgeon, but he passed away really young, so I didn't really get a chance to go under his wing. But between that and being raised by a really independent mom, it's something that I ended up falling into sort of through a winding pathway. We moved here in 2009, but I started here in 2008 as a locum tenens. We lived in New York at the time and came out here 2 weeks on and 2 weeks off. And then they asked me if I'd be interested in coming out permanently, so I thought it would be a great idea. It's a lot of things. It's the community, the group of people that we work with here genuinely care about patient care, plus the nature here is amazing. So some of the more common procedures that we do a lot of hip fractures in geriatric patients. We do a lot of orthopedics like fractured wrists and ankles. I do some joint replacements with knees and hips, finger arthritis, doing some fusions. Carpal tunnel releases are very common, and trigger finger releases are really common. So having my clinic in the hospital is very helpful because we can run between the hospital and the clinic quickly. That way, if there's anything that comes up during the day, we need to check on somebody, or if there's a patient that comes into the ER. Specializing in you with orthopedics really plays a part in that we don't treat the x-ray, we treat the patient. What it means basically is that you can have an x-ray that looks horrible and then the patient doesn't have any problems and we don't have to do surgery. But if there's something that we can do that would help the patient out, then we would go ahead and do it. So we base it on what the patient's goals are, what their limitations are in their life, what they really need to get out of treatment.